Well, it may be surprising, but 25% of Americans do not have a primary care physician. And here to explain why that is such a problem is Dr. Joydip Roy. He is the Chief Medical Officer at UnitedHealthcare of the Mid-Atlantic. Thank you so much for being with us.
Well, thank you, Elsa.
I just want to start out by asking you to explain what primary care actually entails.
So primary care is a foundational part in our nation's healthcare system. It's long considered a cornerstone for medical care, a first resource for many people around the country. Primary care physicians represent a key resource that conveniently and portably meets people's day-to-day healthcare needs, such as annual checkups, wellness visits, routine screenings, routine care, chronic condition management, and importantly, really the coordination with other specialists in the healthcare system.
And how can someone go about finding a primary care physician if they do not already have one?
Well, there's a lot of challenges that exist within our healthcare system, definitely. Navigating the variations in the quality and the cost of healthcare are real significant challenges for many people and the healthcare system more broadly. There are several things that can be done to find high quality healthcare professional. First, people can utilize publicly available online patient reviews to help research and compare primary care professionals in their local area. Second, many insurers offer online resources that help denote high quality, high value care providers, along with cost estimates online for many medical services, such as for a visit with a primary care physician or a specialist. Lastly, a doctor's office is not the only way to access an in-person care. For instance, people enrolled in UnitedHealthcare's Medicare Advantage plans may have access to house calls, which provides an annual in-home health and wellness visit from convenience and privacy of their home. It's also important always to check your health plan to understand the benefits available to you.
And then I know that technology is also changing how people access healthcare as well, correct?
I think, we can look around. I mean, technology has really reshaped our lives and how we all live in the age of Zoom, as we're doing right now. Right? But this also includes people's access to healthcare. We've seen a tremendous shift in how people engage with healthcare professionals with the COVID-19 pandemic, as in-person visits were being avoided during the height of the pandemic. Virtual care via smart mobile devices, computers, has increased tenfold since the emergence of COVID-19, including for urgent, preventative, and chronic condition management. Many local physicians have really increasingly adopted virtual care into their practices to provide accessible and convenient care to their patients. People can check with their health plan or local care provider to determine what types of virtual care resources may be available, ranging from urgent care to more patient monitoring programs that are done remotely. And given the tremendous technological changes that's been spurred by COVID-19, UnitedHealthcare has developed a website to help assist anyone find a location for a COVID-19 vaccine at uhc.com. Given the pandemic, I would urge everyone to get vaccinated when eligible to do so.
All right. And besides improving just the access to care when it comes to technology, I also know that people can save some money doing it that way as well, correct?
Yeah, that can definitely occur. Financial savings can occur. In general, accessing medical service virtually is more cost effective than other settings, such as going to an urgent care or to the emergency room. Virtual care appointments may be even more affordable because some of the cases there's little or no cost sharing involved for consumers. Given the improved convenience and affordability, we really expect virtual care to become increasingly popular. And this technology really represents an important way to help more Americans establish and reestablish a relationship with their healthcare professionals.
Absolutely. Well, we want to thank you for joining us today, Dr. Roy, and for sharing these helpful tips with us around primary care. For more information, you can visit uhc.com. And we'll be right back with more Midday Maryland right after this. Stay tuned.